The internet speed that we have is we're envied by people across the United States that we talk to. And
Blue Valley has assisted us with all of our telecommunications and data.
Blue Valley's been a good partner for CHCS for a number of years now.
Blue Valley has been very progressive as far as staying up with the times, increasing technology, offering us the best possible. If I didn't have internet, I would have to shut my business down because, like I said, 90% of my business is internet. And there is no way I could stay in business in such a small rural community without the internet.
I think it's a key issue that the technology that we have has really allowed us to build customer confidence, and that's really important. If we can instill in that customer the confidence level that when they buy a Landau Corporation product, that we're going to be here to stand behind it and support it, that oftentimes is the difference between whether or not they come to us for that second purchase or whether they go elsewhere.
I can ship, probably 7-8% times more product in the same amount of time because I'm not having to wait on my internet anymore. And that's the difference between making money and not making money. That's my profit margin.
When Landau Corporation was first established in '63, they covered a 20-mile radius. Now they're worldwide. Broadband has given us the ability to aid in that expansion or provide that expansion.
We have a broad range of customers that are located worldwide, honestly, and so it's really important for us to be able to deal with them in a rapid manner. They expect that, they certainly deserve that, and what we want to do is be able to respond to that need. It allows us also to deal with the time constraints that occur when you're dealing with a worldwide activity. And also it helps us deal with the language barrier as well.
My international orders are about 25 to 30% of my daily sales. I ship all over the world, countries that, sometimes you have to look them up to see where they are.
we do a direct beef and lamb sale, and most of our advertisement, the biggest majority of our sales, probably 80 to 90% of our sales are over the internet. It allows us to reach out to people that would not know about our product without it.
We have locations located in Beloit, Kansas, Brillion, Wisconsin, as well as several facilities here in Marysville. So we now have the ability to have unified phone systems. We have visibility of whether people are on the phone. We can easily transfer, provide better customer support, because we can transfer in between plants as if they were all located right here in Marysville.
It's nice being in a small rural area that I still have the things that big companies have. I can be competitive with them because of my internet speed.
Some of the things that we're using our broadband internet for, number one is communications for design reviews and design analysis amongst the people in Beloit, Kansas and Marysville, Kansas, and the engineering personnel in Marysville, Kansas and Brillion, Wisconsin. So we have two different areas where we have engineering people located. So the communication is critical for us to be able to get enough information quick enough to be able to manufacture parts on a real-time basis and get them made and manufactured for everybody to get the prototypes built. So one of the things we do use is Link System, which is a communication system tool that we can bring up a computer screen from another engineer in Beloit or in Brillion, and that works well for us. I can take, sitting at my desk here in Marysville, and access a server that's in Beloit that has manuals on it, drawings on it, Pro-E models on it, and so forth.
We're able to train our officers here locally, in-house, and not just our officers, but all the officers in the county meet here at our office, and we train through the training center for the state of Kansas. We are lucky enough that Blue Valley has given us the high speed to do this with, to be able to keep up with a video conference.
And we were dealing with large spreadsheets that we had to send in back and forth with customer information. Before we had high speed, it would take a long time to send those off, and that greatly increased the speed of what we could do. We could input more records in a whole lot less time. I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
Our organization is really in a very rural, almost frontier area of the state. We're spread out over a huge geographical area, and in turn our reliance upon our strong partnership with Blue Valley is paramount to our business success.
We both serve the same set of people. That overlap is important, and we also have a similar focus, and that's that we're focused on the communities that we serve. Yeah, as Blue Valley updates and upgrades its system to provide greater bandwidth for all the communities that they serve, that also brings about the ability for us to upgrade our systems and really provide services that we normally wouldn't be able to provide without broadband, and the higher speed of broadband access throughout the areas we serve.
A CT scan that took 3 hours to transmit over the phone line takes about 10 minutes now.
When I think of the impact of broadband, I think of the impact that it's had for a system that really is so many miles apart. A lot of healthcare systems, it isn't uncommon that they're 6 stories up or 7 stories up, all one building, and so you're connecting one building or floors or wiring one building. We bring communities together, we bring patient care together, we bring data points together. And so the fact that we are 10,000 square miles doesn't make it difficult anymore, because we're able to mitigate the challenges that miles create for us.
Broadband levels the playing field for rural communities in that we can provide services that larger urban centers would normally be relied on to provide that service, but we can do that now.
When we have patients who come in with true medical emergencies where seconds count, we now are able to take care of a patient within an amount of time that allows us to get that patient transported to the safest environment for them.
We've had instances where a patient's had a nuclear stress test. We sent it to Lincoln, and within an hour the doctor has read the nuclear stress and that patient is sent out because they found a problem.
But really broadband's far more than telemedicine. It's really business as it's done today. And it's truly healthcare delivery in a more modern methodology.
We actually are like the second hospital in the state of Kansas to be licensed with the State Pharmacy Board to have remote supervision. So we have Via Christi out of Wichita has a program called ePharmacy, and they log in once a day at night after hours to verify orders and put other orders in, since we have CPOE and the doctors are putting a lot of orders in themselves. So when our pharmacist is out of the building, we have a document camera and we have a video camera so that he can watch the pharmacy tech, the licensed pharmacy tech in the pharmacy, do the cart fills for Pyxis, and she lays the medications as she's filling it and lays the list and then lays the medications down there, and he checks it, and then we take a picture and we keep that picture, and he does remote supervision.
We implemented our electronic health record in our practice environment back in January, and we had electronic results. We had some components where a physician could call up results, but now we are a true electronic record.
Our clinics are spread out across all the different local communities that we serve. A provider may see a patient in, say, for example, Frankfort today, and that patient may be seen in Centralia or seen in Westmoreland tomorrow. Previously, we would have those encounters, those individual patient visits would have paper charts. Today, they're electronic charts. So the provider really has an up-to-date record, an electronic health record of that patient moving from location to location. And really that's instantly seen by the provider at all the time.
And that's what we all want, is to make the best efficiencies of everyone's time to get to the heart of what is really going on with a patient.